We have the quorum. It is about time. Under 22 of the House rule, we're now electing chairman. We need to have a nomination by a member verbally, seconded by another member. Nominations, please. Mr. Chiu-hung, Chairman, thank you. Chairman, I'd like to nominate Mr. Fernando Cheung. Dr. Fernando Cheung, seconder. Mr. Lee seconds. Mr. Dr. Cheung, you accept the nomination? Yes, I do. Any other nominations? All right, I vacate the seat for you. Thank you, Chairman. Members, thank you very much for your support. To be the chairman of this subcommittee on long-term care policy, subject to your agreement, I think we need a vice chairman. Not on this, Chairman. I must apologize. My PA got it wrong. That's why I find myself here. I'm not trying to be the chairman. So can I suggest that I withdraw from this meeting? Mr. Vincent Fang, will you write in with your suggestion? I don't see any problem with that. Mr. Chiu-hung, Chairman, I agree that we need a vice chairman. I nominate Mr. Tang Ka-biu. Mr. Tam Yu-jong seconds. Any other nominations? Mr. Tang, you accept the nomination? Yes, I do. All right, then Mr. Tang Ka-biu will be the vice chairman of the subcommittee. You want to sit over here, Mr. Tang? Right, next item, date of next meeting and items for discussion. The Secretariat has kindly put together Appendix 2 regarding the terms of reference. The senior citizens, disabled, chronically ill patients who do need long-term care. We'd like to discuss the home-based or community-based care services for them. For the next meeting, I'd like to bring up a more specific issue, which was the subject of discussion over the past week or so. That is the lack of the inadequacy of institutional care. I would like to invite deputations to hear their views. I think a 2-hour meeting would be quite sufficient to have the deputations as well as discussions with the administration regarding this insufficient institutional care, and I hope the members would add their views. Dr. Lee Kwok-lun, or Joseph Lee. Chairman, I agree with you. For long-term care, I think we need to look at two things. First of all, the legislation. Now, long-term care, we basically are talking about institutional care, not home care. The legislation is rather outmoded. We need to have a look at the legislation for updating. Now, in terms of long-term care policy, it may sound as if it is a social welfare policy. Now, we have the concept of aging at home. Now, the state of health for the senior citizens is rather complicated in institutions, and it cannot be addressed from the welfare point of view. I think we ought to invite the health services personnel or officials to come and give their input. And that would be more comprehensive. Right? Well, as a matter of fact, this subcommittee is a joint subcommittee between the Welfare Services Panel and the Health Services Panel. For sure, we will be inviting the Hospital Authority and FHB to join us. Mr. Zhang Kwok-chi, Chairman. I hope that the two bureaus will present a paper to us. They should do a bit of stock taking. What are the existing services available, and in each and every area, what is the waiting list, and also they should project the development over the next 5 years. We don't really need to have any meeting on this. So are you saying that before the next meeting we should have a paper made available by the administration? Yes, indeed, we should have a more voluminous paper. We can give credit where credit is due and ask the administration to supplement where it is lacking. Now, we're not simply talking about senior citizens. We cover the institutional care for the disabled as well. Right, any further comments? Vice Chairman? A couple of things. Mr. Zhang mentioned the 5-year horizon. I remember the Social Welfare Department used to have the 5-year plan, but that doesn't exist anymore. Maybe at the next meeting they may not be able to come up with the 5-year horizon, but they do have the obligation to respond to that. Second, now there are some disabled people who are suffering from Alzheimer's disease. They may not be 60, but they're suffering from dementia. So there is a bit of gray area. The disabled, the senior citizens. I think we have to ascertain where these people would fall into, what categories they fall into. Some of them may fall between two stools. Right, this is also of concern to us. In fact, in many private homes, there are non-elderly people. Some are suffering from brain damages. I remember there was a singer, a rather famous singer, who suffered from brain damage, who was institutionalized. All right, anything else regarding the agenda items? If not, date of next meeting, perhaps we should impose upon the Secretariat to make the arrangement. We'll inform members accordingly. Anything else? If not, thank you very much.